Hi, everyone. We are here for you guys. This is your session. We want to answer your questions that you have about neonatal kittens especially, and perhaps if there's time we can delve into kittens in general, but we want to make sure that you get the answers to the questions that you guys want answered while you're here. There is no PowerPoint for this, but I've got my cards with me if there are other questions or that you just want to have an email address afterwards and you go, oh my gosh, I thought about something and I didn't think about it at the time, so I didn't ask the question. You'll know where to find me, and you've got your information as well. So we're here to help you guys out. So we have a question here about how to stop or prevent tapeworm development in kittens in foster. No obvious fleas. So I think the key word there also is obvious. The little buggers, they hide pretty well. So what I would always recommend doing is, even in kittens that you think look beautiful and clean and wonderful, take a slightly damp, warm washcloth and run it over their fur, especially in the groin area, around the neck, and take a look, especially that cloth, a white washcloth, and then take a look at that washcloth and see if there's rusty color on it. Oftentimes there is, even when they look great, even when you've done a flea comb and you haven't found anything, that rusty color is evidence that there have been fleas there, that there's it's flea debris, it's flea poop, and it's coming off on that rag there. So somewhere, even if they don't seem to have fleas now, they've been around fleas. Some mama cats are phenomenal at keeping fleas off of their kittens, but that doesn't mean that there haven't been fleas. So we always kind of recommend that just assume that somewhere along the way the kittens were exposed to fleas, and if they've been exposed to fleas, there's a good chance then if they ingested any of those fleas that they have also then contracted tapeworm. We don't often see that for several months. So you might have the tiny little kitten that's 8 weeks old and it's good for adoption and you're not seeing any tapeworm segments, but sometimes we don't see those for 3 or 4 months. And then you've got a kitten that has gone home, has been adopted, and then a couple months later, on Susie Q's pillow is a tapeworm segment. And the parents freak out and they return the kitten and it's a terrible mess. So get a tapeworm dewormer in there at least, at one point in your deworming protocol. So that's how you can prevent and stop those.
So that was my question. So the follow-up is, do you do flea preventative every month for all kittens in foster, or you just hit them once?
So if they are young kittens, like what I say neonatal is 1.5 pounds and under, we only do Capstar if you see fleas. We don't do preventative until they're older. So if we come in and say there are no fleas, but like she says that you are seeing the blood and the flea poop, we go ahead and do the praziquantel once a day for 2 days. Especially if you live in Texas, our tapeworms are crazy horrible. They live for a very long time. So even if you're doubtful, just go ahead and give them the Prazi. It's part of our neonatal intake as well. It should be in the binders. If y'all purchase the binders, our protocol should be in there.
So you adopt out really fast. Our kittens tend to stay in foster until they're 3 and 4 months old. So that's where my question is, do we continue to give them flea preventative in case they come in contact?
Yes, because they're going to be in foster homes, which means that they could have fleas in their homes. So yeah, usually when they're bigger, if they're a mom with babies, we don't give them topical because the mom's just going to lick it right off, right? Plus, topical takes about 48 hours for it to even work. So kittens, you want them dead immediately, right? If you've ever seen a flea on a kitten, it's like huge, and they're just sucking the blood right out of them. So that's the big thing. If you see any remnants at all that you think they've had fleas, if mom has fleas but you're not seeing them on the kittens, or if one of the litter mates has fleas, treat them all for tapeworms just to be sure. And yeah, and there's dosage charts in our, I think it's like, what is it, 0.03 is the Prazi dose if you're doing, and it depends if you're doing oral or injectable. We use oral, but I've heard some places use injectable. I unfortunately don't have a preference of either one because we're broke and we can't do injectables, so we can only do the oral right now. So,
Okay.
Did that answer okay?
There's a question here about diarrhea protocols, and how many of you were in the last session? The last session, there were several
Yes.
sessions, that's right. The last session with Cassandra. And so there was some information about diarrhea. The one thing I wanted to add, and then I'm going to turn it over to you for the protocols part, is sometimes, in many cases, fosters who mean well are maybe overfeeding their kittens. As the kittens get older, the time between feedings needs to be adjusted, and so sometimes it's a matter of feeding kittens too often, too much, or food that is too rich for them, and adjusting that formula to be a little bit less rich will help that diarrhea situation. So as soon as the stool is starting to get a little bit soft, we as caregivers need to say, okay, what am I doing with the feeding protocol? And sometimes we can adjust how that stool is looking just by not feeding too much too often or food that it's too rich. And then, of course, we, as was mentioned several times, thankfully so in the last session, we don't have time to wait on kittens. So when I'm talking about that, I'm talking about within a feeding or two. So we're looking at 2 hours, 4 hours, 6 hours, somewhere around there. And then if things are not improving after that second or third feeding with adjusting the amount of food that we're giving, then we need to look further and start some additional protocols.
And I know a lot of you shelters have to use donated food when you give it to your fosters. I know when you're looking at it ahead of time, you're like, oh, that's saving money. But it's really not, because you're giving those kittens diarrhea from switching the food up. So now we're like, is it worms? Is it this? What is it? And we can't wait. So we're going to go ahead and add the medicine on top of it, right? So now you're putting money into a kitten that you could just start off with just keeping it on the same brand. So if you have Amazon wish list, things like that, just stick to one brand. Pro Plan, Max Cat, I don't care, as long as it has that first ingredient that's like a food, like chicken, turkey, something like that. Kittens, as you know, they're developing just like human babies. They're developing their teeth, their brain, their bones, so you don't want a lot of junk food when you first give them when they're little, especially if you're supplementing. If you're force feeding this kitten anyway, give it nutrients. Don't give it the human turkey or human chicken, because you're giving them empty calories right now, right? To us, they're swallowing it, but in the long run, it's not what's going to be best for the animal. So if you can have the same food, go ahead and start off with that. If you have, like us, we have a brand that is donated to us, and when we send them to foster, we give them 2 or 3 cans, and we give them the recipe on how to mix into whatever they want to feed them on. But the big thing is just, if you can, stick with one brand. Ask your people, say we really need it for at least our kittens to have the same food. And then for just medical protocols, once again, it's in the handbook. Pen G is going to be the cheapest and easiest thing. It takes 48 hours for you to see if that poop is going to work or not. You will start out with water, and then all of a sudden the next day it's like soft serve ice cream, and you're like, hallelujah, right? So that's the easiest way. You're only taking 2 days to know if it's working or not, and then if it's not, then you move on to your dewormers.
When you say overfeeding, is it possible to overfeed them when you're bottle feeding?
Oh, excellent question. So the question is about overfeeding. Is it possible to overfeed a bottle baby? And definitely yes. There's a nice, I'm not sure if Dr. Greer is the first one to say it, but this is the person I heard it from first. Think about the shape of the bottle baby's kittens' stomachs after you fed them. They should be footballs, not basketballs. And if they are basketballs, you're feeding too much. It's uncomfortable for them, and that's when we start seeing soft stool. That's when we start seeing stool that is going a little bit gray because they're being overfed. It could be probiotics issues and other reasons as well, but footballs, not basketballs. It's better to feed a little bit smaller amounts more often rather than these giant amounts with an additional time.
And it's hard to do that in a nursery setting, because unfortunately, if you have a bunch of kittens in your nursery, you're gonna fall behind some days, especially if you're if you're volunteer ran, or even if you're not volunteer ran, right? Staff call out sick too, right? So there are gonna be issues like that. So in foster, you definitely wanna make sure that they're feeding on schedule and they're watching that. In the nursery setting, you got to go on schedule, unfortunately, and you'll have some that, the big thing is the minimum of 5%. They got to have at least the 5% of their body weight. If they do under than that, then you got to adjust the times. So if you're going to feed a kitten every 2 to 3 hours, they need that 5%. If they don't hit that 5%, then you need to do sooner feedings. Then so either one, yes.
It's almost as much art as it is science.
Exactly. Which, once again, foster is always best.
Yes. We love fosters. How many of you are fosters? Yay.
Yay.
Awesome people. That's great. Saving lots of lives.
Yes.
Very good.
How many are you guys enjoying the sleep this weekend, right? Yeah, that's what I'm talking about. All right.
So there's kind of a flip side to the diarrhea. The question is, when do you become alarmed when bottle babies are constipated? So that's an excellent question, and we really do have to think about that. We should be stimulating these kittens, these bottle baby kittens, to urinate and defecate every time we're feeding them. They should be defecating at least once a day. Sometimes it's a day and a quarter, a day and a half. Now, when they first come into us and we don't know when they've eaten last, what kind of nutrition they've had, sometimes it does take a day and a half, maybe 2, before we see that first stool. But in general, once they are starting to eat on a regular schedule, we should be seeing a bowel movement every day. And usually, if it's the end of the second day, 48 hours worth, I start to kind of perk up my ears and say, what's going on? Maybe try stimulating them a little bit more. You will feel their abdomens. How many have already taken care of bottle baby kittens? Okay, so you know that feeling that they're trying to go ahead and push that stool out. So maybe we need to stimulate them a little bit longer. But if they're having difficulties, if they're continuing to try, and after that feeding, that stimulation, and maybe the next time after that, and they're still pushing, and you know they're actively pushing and nothing's coming out, then I get really concerned, even if it's only been a day. And certainly after 2.5 days, we're on the vet with the phone. Try that the other way, on the phone with the vet, or bringing them in to have an enema done.
Yes, and they will stop eating. So that's another sign. If they're eating and then all of a sudden they're like, I don't want to do it anymore, that's when you need to take them to the vet right away. But if you're diluting your milk, I don't know if y'all know about the 8-to-1 dilution. We use KMR. The reason why we use KMR is one of 2 reasons. They do have the points, the KMR redemption plan. You save the points on the cans or the bags, and then after like 180 points, you get a 5-pound bag for $8.67. Now, we know it's $75, right, for a 5-pound bag on Amazon. All you got to do is cut those points out. That's all you got to do. Send them in. It takes about 4 to 6 weeks for you to actually get the milk into it, so it can't be an emergency situation. But that's one reason why we use the KMR. A second reason why we use it is you can find it at Petco, PetSmart, Walmart, Tomlinson's, whatever your local place is. So if I'm a foster and it's like, 5 o'clock in the afternoon, and my cat knocks over my whole bag of KMR all over the place, right? Because a cat does it, right? No one else does it. And so what am I going to do? If I'm using Breeder's Edge, which, by the way, I think is amazing, it smells great, works great, but guess what? I have to order that only online. So what am I going to do in the meantime? I'm not going to let my kitten starve. I'm going to run to the local store and switch the formulas, which is the worst thing you can do for a kitten. It wreaks havoc on their GI tract. Same thing with just the KMR. Every milk you introduce your kitten to is too strong. It's not like mommy's milk, so you have to dilute it. So we dilute it to an 8-to-1 ratio for the first 4 feedings. That's 1 part powder, 8 parts water for 4 feedings. The next 4, you do a 4-to-1. And then you do the 2-to-1. It's about a 24-hour period that you're going to have the milk diluted, but you're not going to get your diarrhea or your constipation. With our kittens here in Austin, we were just seeing diarrhea like crazy. And then all these other shelters were like, well, we keep getting constipated kittens. Well, then we realized if you dilute it, it works for both. So it's literally you're just introducing it to the kitten's system. For the first 24 hours, it will plateau for a little bit, so don't freak out, just because it's going to be more water than actual calories. And then, but at the same time, you're not going to have the diarrhea or the constipation at the very beginning.
Yeah, and the note about the scale too, the weight. Please, if you are a foster, if you have a foster program, if you're sending any kittens to foster, please make sure those fosters have a scale, a digital scale that weighs in grams, or preferably in grams, as was also already mentioned, or tenths of ounces, not half ounces, not full ounces, grams preferably. We need to pick up on those minute changes in kittens. And please, I know fosters mean well, and they say they're going to go to the store and pick up a scale in a day or two, but a day or two is literally perhaps a lifetime for a kitten. So if it's not in your budget, if you can find a way to get it into your budget, do donation, do some fundraising, make sure that every foster is going home with a scale when they go home with those kittens.
And we did a fundraiser to where we reached out to the public and went ahead and asked for them, and we put together foster baskets. So that way when your people fill out your application, they're super excited, right? I'm going to take bottle babies home today. Well, then you send them to Target to get their heating pad and Petco to get the non-clumping litter, and then you take them to here to go get their scale. By that time, they're kind of deflated, right? I went ahead and reached out and I said, hey, y'all, I want all these scales, all this milk, and we did a huge fundraiser, got all the supplies beforehand, put together baskets, and that way when people fill out that application, they can come now. I know they have the scale they need. I know they have an auto shut-off heating pad. I know they have the litter box I want, the non-clumping litter. I know they have everything, and then you can go over the scale with them. A lot of fosters don't realize that they think their own human scale that you stand on to see how much you weigh works. It doesn't work, but by the time that they realize that, sometimes they can be a little embarrassed and don't want to say anything about it. By that time, your kittens are probably already dying. So we go ahead and try to get ahead of the game, go ahead and have everything there for them. I think it's only like $2 more. We're not trying to make a profit off our fosters at all. It's just a convenience thing of having it all together. You come grab it, we show you how to use it, and then you take home kittens that day.
That's great.
Non-auto shut-off heating pads. Sorrow. Yes. Thank you. No one wants to wake up every 2 hours and turn that bad boy back on. Yes. No. Yes.
But you can buy them online.
Yes. Dollar General also has them. But yes, Dollar General has them. Sunbeam is the brand on Amazon. And then Walmart has the really nice soft ones that you can wash. But they're like $25 or something like that. So. Yes.
But if you're doing it for a long time, if you're going to be a foster and you're taking multiple litters and, you can clean it and you start to get used to what supplies you like to have as a foster parent too.
Yes.
So.
Like it.
And there was the comment too about non-clumping litter. Yes. Huge. So I think it's caught on mostly across the country that clumping litter is dangerous for kittens. And I also want to make a plea for your pregnant and nursing queens. If you have that mama cat who's going to deliver, sometimes, a lot of times, they want to deliver in their litter box, or they'll deliver, even you make a nice birthing box for them, you make it all cozy and comfortable and wonderful, and maybe they'll deliver outside the litter box, but a lot of times they'll pick them up and put them right into the litter box. And these wet kittens and clumping litter do not mix, and it is very dangerous for those kittens, sometimes life-threatening. So when you have that pregnant mama cat, even if you think she's a week or two away, get her used to the non-clumping litter, so that there's not any last minute change, and in case those kittens come earlier than you think that they're going to come, you'll be safe.
Yes. And I don't know if y'all have seen any feral cat moms that come in and eat that litter. Like I've had, literally they're just like vomit in the cage and it's just full of litter because that cat's like, what is this? Let me try it. Ugh, gross. So we don't want anyone eating that litter and having it expanding in their bellies either. So,
Yeah.
So I'm going to take this one question. Thoughts on Siro Kitty Nurser? So, can I go and take?
Go for it.
I don't like it. It is a disease. To me, it's just disease written all over it. If you're going to have to fill up 8 bottles, put it in a kitty, you're still going to have to warm the bottle, stick it in there. So why? I mean, you're still going to have to put the kitten up to it. It's not. To me, it's still the same thing as you bottle feeding, and then you have to, instead of cleaning one bottle, you're cleaning every single one of those every single time. And then the heartbeat thing, it's cute, but in shelter medicine, no, they will survive without a heartbeat being in there. I mean, they will, you reaching in there and grabbing those kittens every 2 to 3 hours is their socialization. That's what they need. A heartbeat doesn't make them thrive more or less. So if you're on a shoestring budget where you don't have much money and you're like, should I put my money in medicine for my kittens and testing them, or heartbeat kitties or something like that, I would say no to this, because this is a one shop stop. You can only use it for 1 litter. You can't use it, sanitize it in between each one, because it's too, sorry if there's anyone here that sells Zero Kitty. Sorry. Yes, ma'am.
I was wondering, why did you move away from the warming disc? Because that's what we use now.
We still the Snuggle Safe discs, so we still use those in our nursery. The reason why we tell our fosters to use a non-auto shutoff is for fading kitten syndrome. So if a kitten is fading, you can't use a Snuggle Safe disc. You have to warm the core body. You have to wrap that whole entire kitten in the heating pad, including the ears and everything. If you just have a Snuggle Safe disc, you're laying your kitten on it, and it's only warming this part of the body, which means you're not warming the kitten up. So you want to literally burrito wrap that kitten in the heat pad. Same thing with nursing moms, pregnant moms. Of course, mom gets up, she needs to go potty, eat, whatever. That way there's still something warm for the kittens to lay on, because as you know, kittens can't maintain their own body heat. So they will lose, especially newborns, they'll lose their heat within like minutes if you leave them alone. So that's what the additional heating pad is for. But in our actual nursery, we use the Snuggle Safe discs. That way we don't have cords running everywhere like that. And it's great for transport because it can last up to 8 hours. So,
Yep. And easy to disinfect.
very
Nice.
easy, yes.
Do you ever tube feed? Is that a practice?
I love tube feeding, yes ma'am. But only for situations, not if I'm like, I'm so tired, I don't want to feed this kitten. Like, because once again, you're risking aspirating or drowning this kitten every single time. So premature kittens, 60 grams, 70 grams, they're too small to actually suckle. Of course, you always try the bottle first, and if they just sit there like, then I'm going to tube feed them until they get strong enough to start sucking. And how you know that is when you tube them and they start sucking on the syringe or on the tube. That's when you know to stop and move to the syringe. Upper respiratory infection, when they're actually mouth breathing and you can't safely put anything in their mouth without them sucking it into their lungs. That's another thing. We'll tube feed them until the medicine can start kicking in, nebulizing, the Serenia nose drops, things like that to try to open up their airways. But once again, it is one of those that if you get it in the lungs, they will die. Right? So it's like either starve them because they're too sick or, this. So that's kind of our last resort. And we don't ever do it just because it's fast. Once again, going up and down with that tube in your esophagus can erode, cause issues with that. Don't ever cut a tube. If you use the catheter tubes, they already have the holes in them. So all you do is measure from the tip of the nose to the bottom of the rib cage, make a Sharpie mark all the way around, and that's how you know where to stop it. If there's any vets in here, please stop cutting it, because if you cut the tube, then you're making a jagged area that's just bouncing all the way down. And most of these guys are going to need to be tubed for a few days or so. So that's every 2 to 3, 4 hours that you're going up and down every single time. And every time you do that, you risk flooding their lungs. So you just want to make sure it is the absolute last resort when you do that.
Absolutely agree.
Sorry.
I think there's true benefit to the suckling, a natural process of eating. And yes, the dangers, of course. Absolutely agree with everything that you just said.
Thank you.
And please don't, learn how to do this online.
No.
This is just like scares the heck out of me when I see this. This is something that you need to learn. I mean, you don't need to be a vet. You don't need to be a vet tech. You can learn how to tube feed, and it is life-saving when it is needed. But you need to learn from someone who has experience doing it, who knows how to show you, and you need to feel how that tube feels while it's passing. You need to know the kind of, I hate to say tips and tricks, but the techniques to make sure that you're doing it safely, from marking the line to making sure that you're not letting any of that milk come out of that tube on the way down or the way back up. Mm-hmm. You need to be trained by someone hands-on and feel that yourself. Now, sure, you can preview it online, but please don't think you've watched it online and now you can do it.
Yeah, because
scary.
there is a feeling to it. Like you'll slide. It should just be like swoop, like on down. But if you get any like resistance, you're in the wrong way, and then you want to be with somebody who knows what to do if you're in the wrong way. Mm-hmm. So yeah, definitely make sure you have somebody around that can train you on that. And once again, it's not a quick fix.
just wanted to share, I mark it with a Sharpie, and then I put a piece of tape there.
Uh-huh.
So it also helps to hold on to something, so there's no way that you're gonna go, you know.
Any further?
Yeah.
Because they will cry, you know, when you put them in there and they're like, "Mah!" And then it just like starts going out, and then it starts going further and further. Well, while it's going further and further, it's coming up. Meanwhile, the milk is still dripping down out of there, so that's why you want to make sure when you just don't rip it out that you do pinch it and pull it out. But I don't want to go into it. I want you guys to learn from somebody else. So yes, no videos right now.
Okay. We've got lots of great questions up here. Anything catching your eye?
Ooh, okay. I think we already kind of touched on this. What is your preferred formula? Once again, I said KMR just because of the availability of it. You don't want to foster ever or to be stuck where they have to choose to that Hertz cat milk stuff at Walmart. Yeah. That is not milk. I mean, that's not even made for kittens, by the way. It's like junk food for cats, right? It's Taco Bell for us humans. So let's don't do that.
And sadly with that, not so often as 10 years ago, but every now and then we'll get phone calls or emails. You know, I've been feeding these kittens religiously every 2 hours or 3 hours as needed. They're eating great, but they're not gaining weight. And you ask them, well, what are you feeding? I'm feeding them kitten milk. And you say, well, what exactly does that package look like? And then you find out that it's a box that says cat milk. Mm-hmm. And bless their hearts, they think they're doing the right thing. So if you're that person in your shelter or rescue who's answering the phones and who's giving advice, make sure you're asking those really specific questions. What is the exact brand? What does it look like? What's the container look like? Because inevitably what's happening is these people who are meaning well, they're feeding, but the kittens are literally starving to death because they don't get the nutrition from that.
And what's on the front package? It's a kitten.
Yeah.
So of
That's
course
terrible.
It's just horrible. It's bad advertising. So yeah, and to me, I would just tell your people, this is what I want to use. This is what we're using. Just make it simple for them. None of this goat milk, egg mix-up stuff, their whole milkshake. Just say, this is the brand we're using, and that's what you're going to stick them on with.
And that's great for your wish list to put your exact brand on there.
People like that.
And yeah, KMR. We do have many places across the country that do have very good luck with the Breeder's Edge as a quality kitten milk replacer. But again, if you're going to use that, make sure you have things well in stock so that you don't run out. Maybe someday they'll start having those at the local stores as well. Okay.
So I have a quick marquee paste. I don't know the answer to this question. It's a marquee paste question. I love marquee paste. If you have coccidia kittens, Albon, okay, like marquee paste is the best. Where can you get it? We just had a discussion. Wedgwood is one. And then, and what is the right dose? So for neonatal kittens, it's 0.2 per pound once a day for 5 days. And then you do 1 tube to 1 tube water. So like your marquee paste is going to be like $800 and something. And then you have 3 tubes. But if you think about it, you're only doing 0.2 per pound per kitten. So it should last quite a bit. But MWI, we used to order it through, but I think it's back ordered through NWI. Yes, ma'am.
You can also get it as Nazareth
Uh-huh.
from Roadrunner in Arizona.
Oh, that's right. Yep.
There we go.
Yep,
Thank you
compounding
for answering
pharmacies
that
for
for us.
veterinary.
Did y'all hear that? Roadrunner from Arizona.
And we're told to do 0.25 per pound.
0.25 per pound. The good thing is dewormers are harmless, so literally 0.2, 0.3, it's not going to push anyone over the edge with that.
You said basically 1 to 1 with water?
Yeah, so 1 tube of marquee paste, you dump it in your thing and then fill that tube up with another thing of water and dump it in there and shake it. So what is that, 1 to 1? Yeah. 75 milligrams. There you go. Thank you very much. Thank you. Yay. I do. No, ma'am. I get a blender bottle and I stick it in a big old blender bottle and slap marquee paste on it. Yeah, and it lasts for a long time. Yes.
There's a question here. How do you keep kittens from nursing on each other? Anyone have that problem? Yeah. The genital suckling. We got to go there.
Yes. Of course, somebody wanted to talk about penis in here. Okay.
And actually, it's not just genitals. There will be kittens who will suckle on ears and on toes, tails. They'll find a spot. They'll just kind of latch on. Sometimes it's a comfort thing. Sometimes it's a hunger thing. So when you or your fosters are starting to see this, one of the first things you can try is to shorten that length of the duration between feedings. If you're going 3 hours, maybe try 2 3/4 hours. See if they're not a little bit hungry. Sometimes that will take care of it. Sometimes offering them a second helping before putting them to bed and tucking them in to go back to sleep is helpful. Sometimes you just have to watch and wait and watch them fall asleep. Don't let them go for their comfort zone. Keep them just separated until they do fall asleep. And sometimes you do have to separate them. And you can do that so many different ways. You could do separate carriers. You could put just a barrier within the carrier. It doesn't usually have to last too long. Usually after 3-4 days, the habit is broken and they can go back to being wonderful, nice, normal siblings again, and behaving themselves.
Yes.
Additional.
So just basically in foster, it's so much easier because what happens is also extra energy. If you have them in a cage in your nursery, they're like, right? What else can I do? Oh, I'll suck on this. This is great. So, so they don't have very many options. So I feel like once they get into a foster home and have more room to get that energy out and everything, the suckling reduces. But we have found that there is no topical things like apple bitters. The danger of people crocheting things and putting like little diapers on them is then the kitten is stimulating itself on the fabric, and then that fabric gets wet, and then you're just having urine burn on that kitten, right? So unless you're going to just check that kitten every 30 minutes to make sure it hasn't urinated yet, to change it, it's not going to work. So the big thing is just separating until they can get over it and get that energy out on some other place.
And what happens if they get to be 7-8 weeks old and they're still doing it?
To each other or to themselves? Because we've had a couple to themselves. Okay, and so big thing is you got to watch for urination. So you have to stimulate that 7-week-old kitten to make sure it's streaming and not dribbling. If you stimulate and you start seeing, and you can tell when a penis, so normally penises are going to be your biggest issues, right? If they suckle on an ear and it makes a sore, but if they suckle on a penis, it will swell the prepuce, which will constrict the penis, which will keep the urine inside your body, right? And that's not good after 24, 48 hours. So when you stimulate your kitten, if it looks really swollen, you just want to make sure it's still streaming out. That means they can urinate okay. If you do have a kitten that is dribbling, you will need to take it to the vet, and they will have to fillet the prepuce, and then do extra surgery to try to make sure the penis doesn't get dried out. And if it does get dried out, then they're going to actually cut the penis and make issues.
We had one that came in that had been orphaned for a while, and it had actually grown completely over because the person
Swelling.
Kept them from doing that.
Yeah, and then that poor kitten.
Emergency situation, this cat's bladder.
Yeah.
And that's the problem, is then what do you have to do? You have to put this kitten under to do surgery. How many vets are going to put under a pound kitten? Well, how many kittens are going to survive being put under a pound, right? So the big thing is you're trying to prevent that from even happening. So just, you can hear it too. I don't know if y'all have been in a room and you're just like, oh no. But in our cages, how to save space, we just put a cardboard box in between the cage and just keep them separated on the same sides, or do what she said, put them each in carriers until they can learn how to behave themselves.
Yeah.
It's time out.
Yeah. Okay.
Do you want me to do this one?
Sure.
So what do you place in your foster baskets? Basically, it's everything we want our fosters to have. So if it's a bottle baby litter, we will have the bottle kit with the nipples already cut. That's very important. Make sure you don't have your people cutting their own nipples, because you will have flooding kitten mouth all the time. So make sure you pre-cut your nipples before you send them out. Miracle nipples are great because they already have them pre-cut. But remember, you're going to be cleaning those nipples in between each litter. So every time you clean that nipple, that hole is going to get bigger and bigger and bigger. So just keep that in your mind when you're purchasing things. So if you're broke like we are, we're going to go for the cheaper nipples that we cut our own selves. I also haven't seen the miracle nipple actually being a miracle. Like, I haven't gave it to a kitten and they're like, yay, I like this. It's usually you still got to coax them a little bit. You still got to figure out the right temperature, all that good stuff, the right way to hold them. Yes, and so that's in there. And then, of course, the KMR. We have baby wipes unscented because if they have alcohol in them, it will burn. We have our scales, our digital scales. We usually get them from Amazon. They're like $12. And then, of course, daily care sheets so you can keep up with the weight. A lot of people don't want to mark down the output, but like we said about the constipation, you need to be marking every time they urinate, especially with sucklers. You want to make sure that you're marking down that they are urinating in between, things like that. And then, of course, if they are a gruel litter, they're going to get a couple of cans of food, which gruel, by the way, some people call it mush. It's just watered down wet food because kittens at this age can't lap up water very well on their own. So we're adding the additional moisture to their food so they can be hydrated. And then a litter box, non-clumping litter. Royal Canin mother and baby cat kibble. I know it's super expensive, but it is kitten crack. They love it. They will eat it. It's super, super tiny too, so it's really good for little kittens to experiment. They're super curious. They'll stick it in their mouth and be like, this is great. And then I said a heating pad, of course, non-auto shut-off heating pad. And I think that's it. Oh, and Caro syrup, we send that home with all our fosters just in case. And, of course, everyone gets a one-on-one feeding kitten protocol demonstration and how to do it correctly.
Awesome. And some groups will also add in some probiotics, especially for kittens during weaning time or any time that there is stress, which, we think sitting in a carrier and having everything done for you is, how could that be stressful? But moving to a different foster home, different sounds, different smells, getting them ready for adoption, moving on to adoption. There are so many stress times in a kitten's life that we might not think about, and having those probiotics often helps to ward off some of the potential diarrhea that might happen. And also a note on the nipples, miracle nipples, regular nipples. There's a nipple from Forepaws. You still have to cut the hole in it, but it's a more conical shaped top versus the pet egg nipples are fine too, but they're a little bit more rounded. And there's something about that conical shape that a lot of kittens kind of latch onto a little bit more easily. So you might want to have a variety of nipples within your own, as a foster. Now your organization, you might just have, one and done. It makes your inventory a lot easier and purchasing. But your fosters who do this a lot might find that they have better luck with a certain type, or they just are more comfortable with a certain type. So just be aware of that pet egg and Forepaws and miracle nipple.
And if you have a nursery, I do recommend you have different nipples because, you'll have some kittens with their eyes closed that love the little skinny long nipples. I haven't had anyone older like those nipples, but there's some times where they'll just latch on and drink right away off those, and then you have the shorter ones. So even if you have a nursery, I recommend you have different ones. Just remember your costs because they are going to be bleached in between each litter, and they're going to be cleaned with syringes and clean like that, so the holes are going to get bigger. They're going to disintegrate over time, so you just want to make sure cost effective. Sub-Q fluids. How much? It's 10 cc's per pound, which is 454 grams. So if you're in a triage situation where you're getting like 30 to 40 kittens a day and you can't just sit there and weigh all your kittens and make it all out like that, then we usually do bottle babies 3 cc's to 5 cc's, and then gruel babies we usually do 10 to 12 cc's. A good thing though is like if you start giving fluids and you see the bubble getting bigger and bigger and bigger, stop. That means that kitten's not that dehydrated. If you do give fluids and it's just like flat, no bubble, no hunchback kitten, then you know that kitten needs more fluids. So you want to bump it up from twice a day to 3 times a day. Any kitten that's on diarrhea protocol should be on fluids. I know it's very hard to get kittens into foster with injectables, But if you literally will sit down with them and show them how easy it is to do, most people will be a little bit more comfortable. But just remember, if a lot of it's coming out of the back end, you got to keep up with that, and dehydration is one of the reasons why kittens will fade as well.
Yeah, absolutely. Any of your long-term fosters, please teach them how to do sub-Q fluids. It will save you those emergency visits in the middle of the night, because it's always the middle of the night that they're going to crash, right? It's never
2 a.m. Yes, ma'am.
And so that literally is a lifesaver in the middle of the night. Many communities don't have emergency clinics nearby, and even if they did, walk in the
not
door
educated.
cha-ching, it's not in the budget.
Question on the sub-Q fluids, I have a girlfriend that's a surgeon who every now and then, when they do a surgery, they'll hang a bag of lifesaver ringers.
Yes.
And it might draw out this much, and then the surgery's over.
And they give it to you?
Yeah, she'll get all the nurses just to tie off the thing and give it to me. Is
That's
that
perfect.
okay?
Yes, ma'am. That's awesome. Yes.
Somebody said once you stick the bag.
No, ma'am. We use them. Well, sorry. We use them all the time. Yes, ma'am. We're doing numbers, and so we're trying to save lives instead of doing like one case. Yeah, it's an LRS to me, but doesn't burn as much as sodium chloride. So if you can get LRS sub-Q, it's much better than sodium chloride. But if you do get sodium chloride, you can use it for the nasal, and then of course make neb solution. You can use a lot of stuff with it as well.
And just make sure, so you know where those lactated ringers are coming from. Just make sure that it's not a blanket statement that, yeah, we'll take donated lactated ringers. If
From
you don't
animals,
know where they're coming from and you don't know that source personally, those lactated ringers need to be from a source that you can trust. They need to be in their outer bag. And even that, you should check the bag for, once you take it out of the outer bag, you should check for clarity, even in the ones that are being donated to you. And we still need to be sure that when we are, there's the port for being able to put the needle in and draw the fluids out. We need to make sure we're keeping that nice and clean, that we're not dragging any infection or bacteria or debris into the bag while we're using those needles. So we still need to follow good protocols, making sure that's wiped with alcohol first. It's still nice and clean. There's the liquid is nice and clear. There's no cloudiness if there is, or if you squeeze that bag and it's wet at all, you need to get rid of it because there is a hole somewhere that you might not be able to see, but you can find it because it's wet, and that bag is contaminated. It needs to go.
Yes.
Do you ever use electrolytes orally?
So, yeah, we're going to be opposite on that one. So we used to do Pedialyte back in the day. We were like, oh, every kitten gets Pedialyte. Well, Pedialyte only lasts for 48 hours once open. So we were wasting a lot of money on the Pedialyte. So to us, so it ain't going to hurt. Let's just put it that way. If you're a foster and you want to do these extra electrolytes, go for it. But from a cost perspective in a shelter environment, it's just going to be an extra cost that was not worth it for us. We were throwing more Pedialyte away than using it, basically.
Right. I will absolutely agree with the waste factor. But for some fosters, especially who don't yet know how to do sub-Q injectable fluids, when the stool starts getting a little bit soft, maybe adding a little bit of extra fluid, even if it's just water at that point. But if they do have some Pedialyte at home that's fresh, again, it's not going to hurt in small doses for short term, and it may actually help. Yeah, it's financial. Yeah. So we actually do agree.
Yay, high five. Yes, ma'am.
What about Nutrical for kittens?
So, Nutrical has mineral oil in it. So, if you give a kitten mineral oil, what's going to happen? Yeah, so what's the point of Nutrical if you're giving your kitten diarrhea? That's how I feel. So, but older kittens, they love it and it does help. We are more adding KMR to their food for calories. And once again, it's a cost thing. So in our nursery, we're not going to do it because you don't want to mix KMR in food and then sit it out in a cage for hours, right? That's just bacteria growing. So if you're going to do it, you're going to syringe feed them the gruel with the KMR to fatten them up a little bit. We do that more than the Nutrical because it does have the mineral oil that kind of does the opposite for us. So I don't know if you have an opinion on that too.
So yeah, the art of watching a kitten stool. If it's going soft, if it's getting too hard, and the adjustments that we can make. I will say in some Pan-Luke kittens, that sometimes Nutrical or a high-calorie supplement may be enough to help them get through, because sometimes, even with Serenia on board, we sometimes need to feed smaller volume of food, but still make sure they're getting enough calories. So that might be a situation where you can mix some Nutrical, not just by itself, but mix it in with some of the kitten food, that might be able to help get them through a short-term period where they need extra calories. Watch the stool.
And anything, yeah. If you give them anything and it gives them diarrhea, stop. Just stop and ask what is happening here. So,
Yeah.
yes.
How do you feel about baby jars of baby food?
So it's good to entice kittens, but it has 0 calories for kittens. So it's like giving a baby celery, basically. So it's good to entice. So we like, when we're trying to get kittens, I know there's one question here, how can you get kittens off a bottle and things like that? So how do you get them to eat on their own? Basically, I get a plate. You always use plates, don't use bowls. Kittens have bad depth perception, right? Those babies are just going to run into that side of that bowl over and over again. They need to walk in it, lick their paw, and be like, yummy, this is great. So if they're not doing that, you put a dollop of chicken or turkey baby food, no onion powder, no garlic powder, in the middle of it, warm it up, and then the kitten will eat it and then start eating the stuff around it. So that's what we do. But if you're going to go ahead and force feed the kitten, you might as well force feed it food that's going to be nutrients for it instead of the baby food. The baby food is just junk food for them, basically.
And for anyone, taming the tiny tigers and using that high reward kind of food, please, 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 no matter if it's cat food or kitten food from a can, or if it's the chicken flavored baby food, please do not put it on your finger.
Yes.
Because kittens might not mean to bite you, but their little teeth are very sharp, as you well know, and sometimes they'll start licking it and they go, oh, this is great, and then chomp. They didn't mean to bite you, but now you've got the rabies protocol that you have to put in place, and we just don't need to do that. So that you can get a tongue depressor, you can get little popsicle sticks at your craft store, you can get the little plastic spoons from baby. Yeah.
I'm mean. I go, and they're like, what the hell?
And that's a lot cheaper that way, too.
Yes. So, I don't know.
But there's little baby spoons, plastic baby spoons that you can get and you can, put it on something other than your finger, please. Plus the whole, sanitation thing, and you have to wash your hands a lot anyway. So.
And to help get a kitten off the bottle, I know you guys don't think this is crazy, but you literally give them to somebody else over the weekend. They associate you with that bottle. Kittens are smart, man. Like, literally, they will hold out and not eat for 5 hours until you stick it in their mouth. So for bottle babies, they will sit out and you'll be like, I'm not going to feed you. I'm going to skip your lunch, right? No, they won't eat. They associate you. They know you're a sucker and you're going to give it to them. So what I do is I pass them off to somebody over the weekend.
That's a great idea.
And they immediately will start eating with that other person. So just FYI, try it. That's the best way to do it. Gruel bottles, no, because once again, it's a transition. They don't automatically hit 4 weeks and need a different nutrients, right? No, it's the whole process. 4 weeks, teeth. No more nipple. We don't want them shredding nipples, digesting, that kind of stuff. They're already using the litter box, right? They're already pooping around everywhere. You don't have to stimulate it anymore. Just throw a litter box in there and do the whole transition at once. So that way you're not doing a litter box here sometimes, but still giving a bottle at night. If you give them wet food during the day and then give them a snack at night, you're promoting them to stay on the bottle. That's what you're doing. So it all needs to cut out dry all at once. Either they're a bottle baby or they're a gruel baby. There are no mixtures in that.
And some kittens will go right from the bottle to dry kibble.
Yes.
Doesn't happen quite all the time, but there are some that will do that. So offer them some kibble too if they're not going for that gruel or the wet food.
Mm-hmm.
So
I think we're out of time, but I'm ready to. I have lots of questions.
Know.
Do you want us to keep going, or is someone going to kick us out?
Is there a session after us? There's a session after us, is there? Oh, there's a 15-minute break, too.
Well, if your question hasn't been answered, what ringworm oral med
we can just do a
are you
fast
using?
round.
Yes. What ringworm oral meds are you using? So for neonatals, we use 0. We spot treat with lime dip. For 2 months and over, healthy kittens, we use terbinafine.
Okay.
Yes. Terbinafine, yes. I'm a neonatal girl. We don't use it. So, so we just spot treat. You don't want to actually dip your kittens because you don't want them getting wet. Then you have to let them air dry for 15 minutes. No. So if they have a ringworm spot on their ear, we're going to treat it. But the big thing is neonates, you want them to live. Ringworm is not going to kill them, right? Mm-hmm. So you're more worried about your upper respiratory infections, your diarrhea, your pan-luke, things like that. Ringworm is just icing on the cake as far as I'm concerned.
And a lot of the neonates, they don't really get ringworm until they're not really neonates anymore.
Yes.
It takes a little while for that ringworm to take hold. So what might appear to be ringworm in a 1-week-old kitten is probably something else. Some other skin situation, loss of fur. They lose fur when they get KMR stuck on them.
Yes.
So
Gruel
we see
face.
that. Yeah.
Gruel toes and gruel face. That happens a lot.
Yeah. Nursing moms and orphan babies. So this is a really hard one because, again, it really depends. Like, it's a hard call. You've got some bottle babies that come in. They don't have a mom. You're out of fosters. They can't stay in the shelter overnight. What are you going to do? Well, there's this lactating mom over there. Maybe we can put them with them. Maybe you can. There's not a black and white answer. If, however, that mom has kittens who are old enough to maybe stop being with mom, who can be weaned, who can go off to foster, and put that one set of bottle babies with her, that's sometimes an option. The reason we say remove the other ones first is because you don't know what these new kittens have. You don't know what the current mom and those kittens might have. You don't want to expose the other kittens to something that either set can have. So these kittens that just came in, they look great, but they might have been exposed to something terrible. We don't want mom's current kittens to be exposed to that, especially if they're too young to be vaccinated yet. So can they be removed with someone else? And if you do use a lactating mom for another litter, please be careful to watch her. Make sure that she's not rejecting them, that she's actually allowing all of them to feed, and you will see that in their weights with the scale. Please also check Mama Cat. Make sure you're weighing her at least twice a week. We need to make sure that she's maintaining her weight. We need to check her for mastitis, and please only keep it to one extra litter. She's done her job, and then she's done more, and that is a toll on her body as well. So, and just build your foster program, then you won't have to run into those situations as much.
And count your nipples. Yes, ma'am. Cats don't all have 8 nipples. Surprise. Yeah, I didn't know that either. So some cats have 4 nipples, 6 nipples, 8 nipples. So just because a cat gives birth to 6 kittens doesn't mean that mama has 6 nipples to feed that kitten. So that's very important about weighing too. So we do add orphans to nursing moms, but we make sure that first of all the kittens are healthy. We test mom to make sure she's FELV negative. And then, because our thing is if the kitten's only 3 days old, the chances of that kitten of coming and exposed to an illness is going to be slim, correct? Unless you bring them in and it's like pus coming out of their eyes and everything like that, obvious. So we have a better chance of adding newborns to a mom when their hormones are really high. And it doesn't matter if the kitten is 2 weeks old. If a kitten is 2 weeks old and weighs 200 grams and this mom gives birth to kittens that are 150 grams, throw that 200 gram in there because it's all about weight, right? It doesn't matter if this kitten has its eyes open or not and the other ones don't. What you don't want is a big fatty over there knocking everyone else off, or you don't want a tiny runt that you throw in that's like 89 grams and can't even get a chance to get to the nipple. So those are the big things. Right now in our program, that's what we do. We go around and we pull all these pregnant moms into our program. We wait till they give birth, and then we add orphans to them. That's our biggest thing we do. With the whole litter, after they get rid, like mom says, oh, they're 6 weeks, and we take them and we get them fixed and all that good stuff, the chances of her taking another litter is going to be very slim. Once mom gets that freedom and knows that there's a window over here and oh my gosh, like I don't have to have these kittens sucking on me 24/7, it is really hard to make her lay down for another litter. So if you do that, it would have to be like in a cage. You have to keep her in a cage or somewhere. You can't have her roaming around the room unless you have that rare, super great mom. But 95% of the time, a mom won't take a second litter. In my experience, it's much easier once they give birth to sneak a couple of ones in there. But check your nipples, please.